CJSW acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation within Alberta, including Nose Hill Métis District 5 and Elbow Métis District 6. CJSW 90.9 FM is located on the University of Calgary campus, which is situated on land northwest of where the Bow River meets the Elbow River, a site traditionally known as Mohkinstsis to the Blackfoot, Witchuspaw to the Stoney Nakoda, and Gusitsi to the Tsuut'ina. Welcome to Calgary and the SDGs, a special podcast series made by Calgary Catalyst in collaboration with CJSW. This series explores how Calgary connects to the United Nations Sustainable Development Goals, known as SDGs for short, through local perspectives and the real-world impact of actions in our city. In each episode, our host Josephine is joined by a distinguished guest from the field, offering insights on the goals shaping our city's future. Now let's dive in. Sustainable Development Goal number 3, good health and well-being.
To discuss this with us, we have a very special guest joining us today. Let me introduce you to Joy Bowen Eyre. She leads the ALEX, a Calgary-based organization that supports people through healthcare, housing, and social services. With a background in education and public leadership, she brings deep understanding of community needs. Joy is passionate about building systems that work better for everyone. I'm so happy to have you here today, Joy. Welcome to the show.
Thank you, Josephine, for inviting me.
Today we are going to start off with a little bit of background about yourself and your experience at the ALEX. And since our topic is about good health and well-being, we would like to understand what are some of the most pressing healthcare challenges that people in Calgary face, especially those living on the margins?
I think that's a great question because I think front and center of many people today is getting access to healthcare. What we do know is that 1 in 4 Canadians don't have a primary healthcare doctor. And so without having your own family doctor, it's really hard for you to access care. And so people end up in the emergency department. I think the other thing that is most pressing, especially for Calgarians, is mental health and well-being. And we're seeing increases in that and demand for our services because the folks that we serve who choose to walk through our doors every day are people who are at or below the poverty line, who are having a difficult time paying rent. They may be unstably housed, precariously housed. They might be couch surfing. And many of them, to be honest, could be students who are going to here at the University of Calgary.
That presents a very grim picture to start with. And just to add on a little bit to that question, so this is this might be a little bit naive as well. So we see that healthcare is kind of very free or affordable for people in Canada. So looking at that from that perspective, how would you compare those kind of facilities that's already existing to what you just shared about?
So what I love about Canada is that healthcare is free. And if you are in an emergency and you have a heart attack or you have an accident, you are priority seen within our healthcare system. But I think what's really most important is all the preventative health that needs to take place, which is having a primary healthcare doctor. So the ALEX, we're part of a community health center. And so what that means is it's a blend of healthcare and social services. So we provide not only health for physical health, but we provide mental health supports. But we also provide all of those social services supports that are very beneficial to folks. So we also provide housing. And so we provide housing to folks who have been precariously housed previously or were homeless themselves. And so those social services are some of the basics that many of us take for granted. So food, basic needs such as socks and mitts and clean underwear and toothpaste and toothbrushes. Or maybe they need access navigating the justice system. Or maybe they need access navigating how to find an apartment or how to find housing or how to get access to the food bank. And so at our community health center, the model of care that we provide, it's all under one roof. And that's really the exciting place.
So it's a very holistic model. So it kind of covers everything from the basics to the most important ones. Thank you for clarifying that. So the most important part, or the interesting part about this episode, it is not just health, but it also well-being. So from your perspective, from your work with the Alex, what's your idea of well-being? How do you perceive that? And how do you support the mental and emotional aspect of it along with your services?
I think when some of the folks that have typically access to our health services haven't had a good experience within the healthcare system. So they may have felt like they were not treated with respect or dignity or kindness. They may have been racially profiled when they've gone through the healthcare system. And so for us, we acknowledge that, we're aware of that. And so we approach every person that walks through our door from a trauma-informed lens. We ask, not what's wrong with you, but what happened to you. And so that in itself allows people to walk through our door and start to feel that their well-being is looked into as part of their care plan. And so when I think about health and well-being, it is critical for all of us to have the ability to improve in terms of our health care and our health needs. And so in order to do that, you need to create that atmosphere. You need to create that safe space. You need to create a place where people feel that they have that sense of belonging, that nobody is judging them or judging them about their lifestyle choices, the color of their skin, who they love, where they live, who their parents are, where they came from. And so that's really important for us and our entire staff team. And so we do and every day try to strive to ensure that everybody feels welcome, safe, that our place is accessible to them. And so that contributes to that sense of well-being. We want to ask patients what they need as part of their care plan. We want them to have a sense of ownership and agency over the decisions that they have regarding the care that they receive. So quite often folks will come and visit, and the first time they come to visit a health center, it doesn't smell like a health center. It smells like baked goods or a nice warm meal. And so people will come in and get a coffee and a sandwich or some soup, and they'll start to watch and observe how we treat people before they'll look at accessing the healthcare services. And that contributes to people feeling better about themselves. Then they start to develop relationships with everybody at the Alex, and that helps them develop a care plan that they have ownership of, that they can then work with the team as part of a team to then develop a healthy lifestyle and make better choices, and that we can provide the services and supports that they need to increase their well-being.
I like that. It's beautiful. Some of the important words that you mentioned in there are welcome, safe, accessible. It's really important for the patients who walk into a healthcare to feel all of that. So thank you for sharing that. My next question is connecting it a little bit to the economic impact of all the societal problems that we are looking at. So how do these health challenges connect with the poverty, the housing insecurity, or unemployment?
So if you don't have a roof over your head and a house to call home, it's very difficult to get better. It's very, very difficult to feel that sense of healthiness, to have better well-being. We know that without a house or a home, that is not possible whatsoever. We also know, and research and the evidence suggests, that people who are living in poverty don't have the ability to make better food choices. If you've been to the grocery store anytime soon, I was at Costco the other day and I almost collapsed with my bill at the end of it. a lot of folks don't have even the ability to make good food choices. And so if you're not eating well, then that contributes to not feeling well. And so maybe you're choosing foods that are cheaper, but they're not good for your body. And so that is critically important. We also know that people who are living in poverty are quite often not living in safe, affordable, accessible housing. And so that contributes to anxiety and stress. If you're living in a place that you don't feel safe in, then that's very challenging for you. That increase the stress, the anxiety, can contribute to depression. And then if you're not eating well and your body's not feeling good, you don't have the ability to take care of yourself in terms of being physically active. If you don't have money to be able to afford a bus pass, to be able to go visit friends, that creates social isolation issues. You might not have the money to be able to get on transit, to be able to go find a job, keep a job, continue to go to a job. So poverty is really at the root cause of many of the healthcare issues that people face. Because at the end of the day, if you're just trying to survive day to day, the last thing you're going to do is probably go to see a doctor because you've got something wrong with you. And then when you do finally go to see a doctor, sometimes the first place you go to is the emergency department, which is the last place you should be going to.
No, I completely agree with that. It should be the last place to go to. So as we look back at what you've just said, it's really an interconnected web of everything together, right? And one of the things that I really like about the Alex approach or the model is that the holistic approach that you've just mentioned about, it doesn't only work on the health, it works on the food, it works on the housing part of it. It includes the well-being as well. So I'm going to ask you a little bit to expand on this holistic model, and how did this come into place? Like, what inspired this, and how's its impact so far?
So I certainly can't take credit for the creation of the health center, community health center model, but the Alex has been around for 52 years, and we're actually the largest community health center across Canada. There's several hundred across Canada, but there's only 4 in the province of Alberta. There's us and Cups in Calgary and 2 others in Edmonton. And where the concept started in Calgary is that there was a doctor and a nurse and a social worker who are apparently friends. And they they got together one day and there was like, I don't think the type of care that could be provided is being provided. And they kind of got together and decided to create this little niche get together, and it has grown and blossomed since then. So they started with 3 people, and now we have well over 300 plus staff, and we have 68 physicians on our staff team. And of those physicians, many of them are U of C grads, which is super cool. But we have family doctors, we have OBGYN, we have internal medicine, and we have psychiatry. And so we are a one-stop shop. And so when people come to us, you only really need to get off at the Franklin LRT station, walk about 150 meters, and everything is under one roof, which is super exciting. Because in addition to having physicians on staff, part of our team is mental health clinicians, nursing, social work, peer support, which is a critical part. So when people walk in the door, they see somebody who looks like them, who's had their same journey, who's had lived experience and can connect with them. We have the community kitchen out front. We have a pharmacy on site. We have a lab on site. It's pretty much, if you need it, we have it there. And none of our doctors wear white coats, which I really appreciate. And they all go by their first name. So it's Dr. Jane, Dr. Bob, Dr. Josephine, Dr. Joy. And they're kind of cool. It kind of is very much a CJSW vibe when you walk in our place. We play music every day. Friday is Reggae Fridays. Woo-hoo, so I'm missing that today. And the docs wear jeans and Vans. And so when you walk in, you don't feel like somebody, it feels more comfortable. Like it feels like you walk in when you walk in at CJSW, and it's a good feeling. It's right. So people feel that. And I think that actually helps when they walk in that door, because while you might have been nervous the first time, you kind of feel that, hey, this place might be okay and I should give it a try.
You're listening to Calgary and the SDGs, a podcast focusing on how Calgary connects to relevant United Nations Sustainable Development Goals. You're currently listening to an episode focused on SDG Goal 3, Good Health and Well-Being. To find this and more episodes, go to cjsw.com or the CJSW app.
That sounds really amazing. Should be a very wonderful experience for the people who are coming in. So really appreciate that. So since you mentioned about like everything in one place, so there's a lot of technology and systems involved in it. So my next question is to ask you about how is this technology or cross-sector collaborations helping to reimagine how healthcare is delivered today, and can you expand a little bit more about it? How is it different from the traditional care, and what do you hear from people who uses it?
Sure. Well, the first thing I'll talk about from a technology perspective is you've mentioned our mobile buses. So we go to where people are. So if you can't make it to our main site at Franklin LRT station, we have 4 mobile buses that will go to other places. So that in itself has been like a radical, innovative piece where we partner with other organizations. So we go to the schools where kids may need more support. We go to areas of town where we know that people have difficulty accessing healthcare, and we go to other social services agencies where we know that they have clients that will benefit from our services. So that's the collaborative piece, which is really exciting and really is the core and the foundation of what we do. We know we can't do everything, and we're better if we partner with others. From a technology piece, we just started trialing an AI scribe for our physicians. And so at first, if you know doctors, they're a little skeptical at first. They're like, I'm not sure if that's going to be super cool. I don't think my patient's going to like it. Well, everybody freaking loves it. The doctors love it and the patients love it. So what an AI scribe is now when you go to see your doctor, I'm looking at you eyeball to eyeball the entire time. And instead of me looking down and writing notes like old school or typing into a computer, the doctor looks directly at the patient and the client. They have a conversation, and the AI scribe picks up everything, gets all the notes, tabulates everything, writes the prescriptions and everything. It has been an absolute game changer. You know what the super cool part is? It allows our doctors to have better mental health and well-being for themselves, because at the end of the day, they're not stuck doing charting at the end of the day. And the clients are reporting back that they actually have had a better experience one-to-one with their physician. So that has been great. And then the other thing which will benefit all Calgarians is that because of the AI scribe, physicians can see more patients one day.
Oh, that's definitely
so
true.
It's a win-win-win. So it's like that technology piece has been a game changer.
That's very cool. I did see it in the news a couple of weeks before that doctors are being encouraged to try AI scribes, but I never got to know how did it work. Did it work at all? So it's good to know your perspective on that. Thank you for sharing that. My next question is one of my favorites too. We are coming into youth health or school-based programming. I've seen mobile vans in the schools myself of Alex, so I would love to know about how the Alex is supporting youth, and what are some of the problems youth of this day are facing in schools or young children from your perspective.
So we're pretty excited that we have 4 health buses. One of them specifically is our youth health bus, and we partner directly with the Calgary Board of Education and go to high schools to provide mental health and physical health supports for 14 different high schools, which is exciting. What I can share with you is when I first started at the Alex over 6 years ago, the concerns where youth were getting on the bus were either sexual health or mental health. And so youth were looking for help in terms of birth control, STI, pregnancy testing. What I can share now is that has shifted, and the majority of the requests getting on our bus is for mental health supports. And so we've had to change the staffing model on the buses to address the needs of the kids who are getting on the bus. So kids are getting on the bus and they're stressed, they're anxious, they're not coping well, they're not doing well. And that could be because of a number of different factors. We know that the pandemic was very game-changing for everybody, but it really affected children and youth because it disrupted, from a developmental standpoint, their regular norms that kids would have experienced. So we're seeing an increase in kids with mental health challenges. And so our youth health center bus is addressing that directly, not the bus, the people on the bus, let's be clear. So that's one way in which we partner. And then we have a dental health bus, which is probably the coolest thing on wheels in the city of Calgary. If you ever get a chance to see some of the pictures, it is absolutely magnificent. And so we partner directly with Calgary Board of Education and Calgary Catholic School District, and we work directly with what used to be formerly called as Alberta Health Services to determine which schools that we should be going to. And so when that bus goes to the school, the kids are pretty excited because it looks super cool, so kids don't want to miss out. But what's really exciting is the team goes in prior to the bus and the team going in there, and the kids get to learn what is oral health care. Why should I be brushing my teeth? Why is this important? Why is this bus coming to my school? And so it is a free service. We send home forms to all of the kids, and it goes to see kids in grades 2 and grade 6. So you may be saying, if you're listening, why are we going to grades 2 and grade 6? Well, grade 2 is when teeth usually fall out, your baby teeth, and grade 6 is when your molars start coming in. So it's a great time for our dental team to be looking inside your mouth and to see what's going on. And so that is really exciting for kids to then get excited about taking care of their teeth. We know that, did you know this? That the number one reason why kids go to the Alberta Children's Hospital is because of oral mouth care. So they've got pain in their mouth. And so you would think it's because of accidents or other things. It's because of problems with teeth and mouth. And so preventative care for oral health care is absolutely critical.
I didn't know that
before.
It's so cool. Blame it all on the candies and sweets.
Yeah, blame it on the candies and sweets. But also maybe if good oral health care isn't part of a family's routine, then we're going to schools where we can help out directly with that. And we all know if anybody's ever taken a trip to the dentist in the past year, it is really expensive. And so that is a huge barrier, especially when you're on low income.
No, I understand. I had some of my dentist expenses last year, so I can definitely agree with on that. So we did speak about preventive healthcare in the beginning of our conversation. I would like to know a little bit about early intervention, both from the perspective of the work that the Alex does, and also from your perspective of being in the healthcare, with all these experiences. So how do you think that preventive early intervention can help in reducing a lot of these chances of being sick or diseases or infections?
I think early intervention is absolutely prevention is the way to go. And if you can't do prevention, then early intervention. One of the coolest things that we started a couple months ago was we utilized one of our small Sprinter van health buses to do early testing for diabetes, because diabetes is one of those things that kind of sneaks up on you. And it sometimes runs in families. It can be genetic. But if you can diagnose early, then you can put treatment plans in place to help somebody. Sometimes the folks that we see, they've had diabetes for a number of years, and it's really done significant damage to the body, really makes you not feel well. And then if it really goes untreated, you can lose limbs. And so sometimes some of the folks that we see on street have had amputations, and that could be because of frostbite, but it also could be because of they haven't been treated for their diabetes. And so it's this program that we developed in collaboration with one of our physicians. We do point of care testing. Dr. David Campbell, who also is a professor at the University of Calgary and works at the Alex, He's phenomenal because we've created a whole program to then do the follow-up care for anybody who's been diagnosed with diabetes, put a full care plan in place, and then help them with their diabetes care and treatment.
That's really helpful.
Yeah,
Again,
like it's so simple. It's such a simple solution. And so, but if you don't have access to a family doctor, how can you get treatment?
That's completely right. And it kind of connects back to our early questions about access to healthcare. My next question is about, we spoke about the preventive systems, we spoke about the early intervention, but I'm also trying to understand how can, from the policy side, from the government side, and also from our different community stakeholder side, how can we create a long-term impact on addressing some of these issues?
Well, I'm going to give out a shout out to our former Minister of Health, Jason Copping, who Jason had said years ago that we need to be investing in primary health care, because what our province has done a really good job of is doing acute care. So investing in hospitals and hospital care. So the province looked at what they could do differently. And so that was taking a step back and saying, where is the best bang for the buck? How do we invest to ensure from an economic viability and from a individual community member for their long-term health and well-being? And so investing in primary care is the key. The hard part is right now we've got a system that is so heavily focused on acute care, which is hospital care, that we now need to invest in primary care, and we need to shift that gap between acute over to primary care. Make sure everybody has access to a primary healthcare doctor so that we can do prevention testing, like diabetes testing, make sure kids have got a regular physical, make sure all of our, all adults have a regular physical, so that you can screen for cancer, you can screen for diabetes, you can screen for mental health, so that you can do all of the early intervention. Because if you do early intervention, it really will have a huge benefit in the long term for not just the individual, but from a systems perspective and cost. Because the most expensive part of the healthcare system is our hospitals.
Got it. And when we look at this bigger picture about what we can do further to improve our situation here, what do you think, what's your perspective of where healthcare stands currently in our province, or even just for Calgary?
I think it's really messy right now. And I think provincially, our government is really trying hard to try and figure out how to unpack that and untangle that. What I can share is that they've been super excited about our model of care, the community health center model of care. And we will invite anybody and everybody to come in through our doors so that they can see how healthcare can be done differently. I think there's an acknowledgement that the community health center model can be that solution. I think the community health center model could be expanded. We could be in small rural communities. We could be on reserves, and we can be in big municipalities, because the concept of a community health center model is saying who lives in that community, what is the population of that community, is it young people, is it older people, what kind of services do they need, and then you create that community health center model based on the types of folks that live in that community. And if we could shift to that model of care, then I think it'll benefit the community at large, because you're putting the right services in for the right people at the right cost.
It's beautifully said. Thank you. So we're almost towards the end of our conversation, and I wanted to close it with a question about the Alex, because I really like what Alex is doing, and I love the model, like going where the person needs you, and also looking differently at the entire model of hospitals and how people approach healthcare. So based on that, what would you suggest that other cities or healthcare systems can learn from the Alex? If there's one thing that they can just take, copy, and establish in their own models, what would that be?
Leaning into team-based care and recognizing that not one individual is responsible or can manage an individual patient or client, and that you're better together. And so our teams are made up of physician, nurse, mental health clinician, peer support worker, could be justice navigator, housing locator. And when we work together as a team, it's an ultimately better experience for the patient.
That's beautifully said. I always do ask one question before the end to know a little bit about the guest. So my question today is, from all your experiences of working in the ALEX or in the healthcare, is there any really heartwarming moment or experience that you've come to that you would like to share with the listeners today?
I think if I'm having a bad day, anybody in our team knows that I'll go spend a little bit of time down in the space that are on the main site. And I can tell you firsthand that we had an individual who is one of our housing clients, had come in, had been unstably housed, and we put full wraparound supports in place for that individual. Housed that individual for a number of years with a full team-based care approach. That person graduated from our housing program and now gives back to the ALEX and volunteers not only at our main community kitchen, but also at our food center. From a Maslow's hierarchy perspective, and when you think about self-actualization and giving back, he went from the bottom of the pyramid where he needed food, clothing, shelter, and housing, and now you can see and feel his vibe when he is contributing and giving back. We'd held an all-candidate federal election forum at the food center, and I'd said to him, "Hey, what are you doing here?" I said, "Didn't you just volunteer over at our main site yesterday?" And he looked me in the eyes and he said, "Joy," he goes, "there's no place I'd rather be." He says, "I love helping out and I love giving back, and the ALEX made a difference and allowed me to be here today."
That's amazing. I'm happy to hear about that experience today. Thank you so much, Joy. That wraps up our episode today. I really appreciate you taking the time to come and share with us your thoughts and perspectives and the amazing work the ALEX does. Thank you so much.
Thank you. Thanks for your time.
This concludes this episode of Calgary and the SDGs. To listen back to this conversation and find more episodes from the series covering other SDGs, visit cjsw.com or download the CJSW app.